exploring and all these techniques that we do, well, a lot of times we work with parents separately because all parents have different skills and different kids. Social skills, like was talked about today, are extremely important. I'm just going to do a quick summary. Like for ADD, a lot of things we work with is making friends, how do you control your behavior, dealing with teasing, because the ADHD kids can kind of react. For autistic spectrum disorder, a lot of things we work with are making friends, expressing feelings, making eye contact. But there's lots and lots of skills you can work on, and you go through different stages in practicing and modeling this. And that's the, like, we're going to have a group this summer, and the other doctors here do these groups all year long. Important to add. But one of the things we found is if you treat the brain first, all the other treatments work better. And we feel like neurofeedback is really the foundation for most of the students we see. For people coming in with ADD, most of the time we can do the neurofeedback without medication, or if someone's on medication, our goal would be to help their functioning improve, but see if we can reduce or eliminate the medications. Think about it. Most of us, you take your brain everywhere you go, even though some people say they feel like they don't. But so this isn't something that wears off at night. This isn't something, if you forget to take a pill, that's going to wear off. And so it helps parenting, it helps the social skills, it helps you do better in school, it even helps us talk to people in therapy. And with the brain map and looking at the subtypes and getting a good diagnosis and individualizing the neurofeedback, our results are getting better and better. So we feel like it's much, much more promising than it used to be, and there's lots of kind of hope with how this is helping children, adolescents, and adults. I'm just going to go over one more slide, and then I'll take a couple questions. I put this on here for a reason. I wanted to explain it. A lot of people come to these and they have individual questions, and we can't really get into lots of details about kids, and there's privacy and everything, and some people are embarrassed. But if you sign up on the sheet there and give us your phone number, myself, usually I try to call people just to kind of ask about the family or the kids and kind of get some feedback if you want like a consultation. But I start doing this 5 years ago because some people come and they come to these talks and they're in a crisis and they don't tell anyone. 5 years ago I did a talk at the Aliso Viejo Library. Very similar. I mean, we didn't have this much research back then. And I had someone who sat in the audience who signed the form. I didn't know this. That weekend I read in the newspaper that there was a young adult with Asperger's that was teased a lot in high school. He had graduated high school. It was over the summer, right about this time of the year. He got really depressed and angry. One of the kids lived next to him. He went next door. He shot this peer of high school. He shot their parents, and he went back to his house and shot himself. The mother sat in my seminar the week before, and I saw her name on the sheet. And I just felt terrible. I mean, I called her, but just to convey my condolences. And I felt, geez, wouldn't have been, what would have happened if she would have said, oh, I think my child has Asperger's and he's depressed, and we probably would have done counseling or therapy or I don't know what, but at least, so after that I decided to do something, just kind of make it easier. So I just wanted you to know why I put it there. So that's our contact information, our website. Mark, my office manager, in the back. If any of you are really like in that type of crisis, feel free to talk to him. Because I'm hoping that I never have to see that again, see someone's name there and read about him in the newspaper. But on a positive note, I want to end that we really think is optimistic. We can use the QEEG to get a better diagnosis, look at subtypes of ADD, Asperger's, and autism, and really develop specific individual treatments that can get biological results, but that can, without side effects, and get lasting results. And that's really what I think the goal of treatment is.